Bloomberg Audio Studios. Podcasts, radio, news. You're listening to Bloomberg Businessweek with Massar and Tim Stenovec on Bloomberg Radio.
Well, President Trump making comments at Davos earlier today, they were wide-ranging. He touched on tariffs, and he told leaders a key push in his second term would be using tariffs to drive manufacturing back to the United States. Here's what he said, Carol. If you don't make your product in America, which is your prerogative, then very simply you will have to pay a tariff. Differing amounts, but a tariff which will direct hundreds of billions of dollars and even trillions of dollars into our treasury. So maybe kind of like pour one out for the folks at the companies who are thinking about supply chains globally.
It gets more complicated. Per Hong regularly speaks with those folks. He's partner in strategic operations and performance practice at the global management consulting firm Kearney. He joins us from Davos, Switzerland, where we know it's a bunch later. Per, good to have you here with us. First of all, I got to ask you, the Trump event, the Q&A today, I am curious. Our understanding is that the only thing everybody wants to talk about is the Trump administration, but give us your perspective in terms of some of the conversations around today and around the new president, well, second term of the president, once again.
Well, thank you for having me, Carol. And indeed, this has been. I'm speaking from Davos, and many of these reflections from what we've been hearing. Now, I've been coming to Davos for a number of years now. I mean, this is, and I've been here a number of times. I think the most succinct takeaway or distillation that I heard in the conversations I was having, Adi Ignatius, the chief editor of Harvard Business Review, in a conversation I was having with him this morning, described it as a real juxtaposition and contrast between Davos man on the one hand and Mar-a-Lagos man on the other. Really a contrast and a very different feel to maybe some of the past Davoses that have been a part of. Some very strong similarities, but some important differences, particularly in light of these announcements that you've been discussing.
So Davos Man, it's also the title of a book by Peter Goodman. We've spoken to him about that a couple of years ago. We know who Davos Man is. Who is Mar-a-Lagos Man? Well, I mean, Mar-a-Lagos Man, we maybe heard from today. I think this contrast, Davos, the Davos man, the globalist, the individual, and certainly Dr. Klaus Schwab's vision 55 years ago was bringing together this group of business and public sector and academia together to really discuss and debate some of the most salient, important issues in the spirit of building a better future collaboratively. Mar-a-Lagos man, I mean, that's a turn of phrase, but much more focused on the now, talking about the importance of being present and driving some of the opportunities, particularly around trade, tariffs, export controls, and some of the other impacts, deregulation to incent U.S. business perhaps, and really reassert U.S. politics or U.S. back in the center of many of the dialogues here that are less global and more maybe a little bit more transactional.
Well, so Per, what does this mean? We brought you initially on to talk about supply chains and what this means. Yeah. I was listening to a great conversation on our Bloomberg Surveillance earlier today, and it talked about, is globalization dead? And they're like, no. But I am curious what it means, because we've talked a lot about nearshoring and onshoring in terms of global supply chains, redundancy in terms of supply chains. But what is really happening?
Well, I mean, part of the context in terms of what's really happening is also acknowledgement that supply chains have been shifting significantly. Over there has been a trend towards, we call it deglobalization or more localization. Coming out of the pandemic, many of the shortages and disruptions that we're experiencing, global supply chains have been driving, have been rewiring, increased nearshoring efforts, diversifying dual supply, the use of advanced technologies like AI, which was very much on display here in Davos over the last week to adapt their products and services. But in light of many of the pronouncements that we're starting to see, pressure on global supply chains will reach a critical inflection point in 2025.
What are you hearing?
That is going to put further onus on supply chain leaders to adapt.
So what are those leaders telling you right now? Because that's what we really want to know. I mean, your job is to advise them. You speak to these folks all the time over at Kearney. What are you hearing from them? What are they concerned with, and what are the changes they're making?
Well, I mean, there are. I describe the overall tone, certainly in the conversations we've been having here, is some measured optimism, or optimism with some caution. Many of the changes that have been described, on the one hand, within the business community around new policies, around deregulation, tax incentives, simplification, very much can supercharge the investment community and really spur, a fresh wave of growth, particularly in sectors like banks and financial services and fossil fuel producers and big tech, certainly with reduced antitrust regulations, perhaps potential some fewer restrictions. But that measurement, and maybe where a lot of the caution comes in, is, or maybe where some of that optimism or where that potential is muted, is by a real sense of uncertainty. And while the extent of the incoming Trump administration's tariff policies and export controls is unknown, he has previously spoken about his desire to levy 10 to 20% on most imports, targeting up to 60, even 100% tariffs on China. And that can have, and there's much at stake for a global economy and for global supply chains if that manifests itself.
Yeah, especially if it gets to something as steep as you suggested, or he has suggested. But I guess, as they say, the devil's in the details, and we'll have to wait to see ultimately what comes down from Donald Trump and his team. Per Hong, thank you so much. Really appreciate you saving some time for us. We know it's later over there in Davos. Per Hong, he's partner in strategic operations and performance practice at Kearney, as we said, joining us from Davos, Switzerland.
Carol, when we talk about the gender gap, we're often talking about gaps in education or political participation or salary.
Right.
But there's also a pronounced gender gap when it comes to healthcare. I confess, I had no idea about this until I started researching our next guest.
I mean, share these numbers.
Okay. Okay. Well, McKinsey says that closing this gap could add as much as $1 trillion to the economy by 2040. But perhaps more importantly, it could add 500 healthy days to a woman's life over her lifetime.
All right. That seems like a really good thing. Carolee Lee is working to close that gap. She's founder and chief executive officer of WHAM, which stands for Women's Health Access Matters. It's a nonprofit that encourages research and investment in women's health, as well as works to, in the organization's words, quote, eliminate the inequities and bias in research and enterprise. She joins us right now from Greenwich, Connecticut. Carolee, it's great to have you here with us. Just paint the picture. I have heard anecdotally from many women, young, older, where they do walk in to a doctor and say something and they're very much dismissed. But tell us about this poor healthcare or poorer healthcare that women are dealing with versus men.
Sure. Well, first of all, thank you. Delighted to be with you. So let's just frame the picture a little bit. Women are 51% of the population, same about in the workforce. They make 85% of the spending decisions and 80% of the healthcare decisions. Okay, so first of all, let's start with we're not a niche market. And then you have to really look at, where we're lacking. And if our first reports, which came out 4 years ago that we did with the RAND Corporation, showed how little money is invested in women's health research. In fact, NIH invests less than 4%, for example, in heart disease, when it's the #1 killer of heart disease. So there are tremendous disparities between the incidence and the burden of disease and the amount of monies invested, whether in research or in business development.
Can I ask you why that happens when it comes to research in women's health? Why does that lag?
There's a lot of answers to that.
Is it just biasness? Is it men in charge making the decision about where the money is spent? What is it?
Yeah, I think for many years, unfortunately, there was bias, intended and unintended, and it just grew into the system. And in many situations, women are not at the table, and we as frequently or as in the kinds of positions that they should be. And we know that these kinds of inequities don't create or generate the same kind of results when you have sex differences in the room. And you need to have men and women in the room and making these decisions.
So let's talk a little bit about how to solve this and what you are doing over at WHAM, who you're partnering with, who's getting involved. How is this a problem that gets solved?
So it's not going to be easy to solve, but the first thing is to create greater awareness. So, for example, I just spoke in several different instances in delivering the findings from our new WHAM report out at the JP Morgan Health Conference. And that's important for a lot of reasons. One is the report itself, which is available online, obviously, at our website, whamnow.org. It really paints the picture of what every investor should know. And part of what we're trying to do now is change the investment community. Our first reports did show how to change the research community and investment by showing that in 4 disease areas, and I mentioned heart disease as one, in 4 disease areas that would affect a woman in her lifetime, a $350 million investment, which is what NIH had allocated to those 4 disease areas, would have yielded a return, if just increased by a small percent, would have yielded an economic return of 14 billion to the economy. There's no.
What is that economic return? You know, we're into economic statistics and so on and so forth. Are you just saying that healthier women are much more productive in terms of economic output? Is it as simplistic as that? Okay.
That's part of it, and it's also obviously taking care of their families, all the different costs that are involved in either treating a disease and or being out of work because of inadequate care or because of diseases that make you not be able to stay in the office, such as menopause. It's not even a disease, it's a condition. But the numbers of hours that are lost, both to the woman in terms of her earnings and to the company, are extensive. So I think one of the first things that we have to realize is that one of the things we need to do is not just think of women's health as reproductive health. And so what we've done is try to redefine women's health to be exclusively, disproportionately, or differently. And that is an NIH definition, by the way, because exclusively means things like, let's say, more gynecological issues like menopause, ovarian cancer. Disproportionately is autoimmune diseases where women are 80% of the people have autoimmune. How about Alzheimer's, where we're 2/3 of the population and twice as likely to have Alzheimer's? And guess what? We don't have the research to show us why. So if we don't have the research, then you can't even begin to think about it.
Is it because we live longer? Don't we still live longer, women?
No.
Then why is my life insurance more expensive than my wife's? They told me it was more. They told me my wife's is cheaper because she lives longer.
Yeah, I think that's not true, but it's a great question. I'm not qualified to answer that one, but all good questions. I mean, women live on average 5 to 6 years longer and in poor health. We know that, and with inadequate finances.
So we do live longer, but in poor health, is what you're saying.
Correct.
Okay.
That's exactly right.
Okay.
Costs us more, and we don't have the money.
There's a really interesting. Sorry. Go ahead.
Well, I'll just finish the exclusively, disproportionately, and differently. The 2 areas and the 2 conditions that affect women differently are cardiovascular disease and lung cancer, for example, where cardiovascular disease, to your point, Carol, women are go to the emergency room with chest pains and all kinds of issues, indigestion, shoulder pain. And in many instances, they're given an antidepressant. They're told that they're having anxiety and they're sent home and they drop dead of a heart attack. Why is that?
I don't know. So, why is that?
Yeah.
I mean,
well, because first of all, because women experience some diseases such as cardiovascular disease differently. Not all emergency rooms and not all medical practices are that familiar with these differences. And often if they are, they'll misdiagnose it, which is very unfortunate. But some of the symptoms are, they could be anxiety, but women are not often given the same tests as quickly as a man is.
All right. So listen, those that are heading up medical institutions, hospitals, you have a quote in the study from Michael Dowling, President and CEO of Northwell Health. He has been on our air several times. The quote is, "Women's health needs innovation and creativity. It needs everybody to look at it in a new way." I have heard from doctors that such a big part of their job is also thinking about money and kind of getting donors to donate money that goes into R&D and so on and so forth. So how do we, I'm thinking about these heads of institutions, if they are aware of this, why aren't we making sure that R&D money gets allocated to more women's health issues?
Well, it is happening slowly, but the problem is this word slowly. In other words, there is more money flowing. And over the past 5 years, there's been a significant amount of money And I think between 2018 and 2023, the women's health gap grew by 300%. So the amount of research that is being done is growing. It's just not growing at a fast enough rate, and it's not significant enough. And that's a problem. There's no question about it. And I think part of it is the lack of understanding. So, for example, even women's health is such a high growth opportunity. You are focused on economics and opportunity. 5% of the conditions that impact women, a woman in her life are exclusive to women. The other 95% are not. So think about that. If
you're saying, like, in terms of investment dollars, companies that are addressing some of these issues, why is it maybe more going into it? Is that kind of the question?
95% of the market is still untapped, leaving a massive opportunity because.
You know, you have some of the companies that are listed in your report, really, really interesting companies that we've had on our air. Maven and KindBody are a couple of those companies that cater to women exclusively that have raised money in the past few years from private investors. Other companies, including Aura, we've spoken to that CEO in the past couple of months. You argue that they treat women differently. Will we see more capital flow to startups because you think it is such an untapped opportunity?
Yeah, I think so. I mean, this is the point of the report, is to lay out the groundwork that says this is a market that's ready for growth. So investments in women's health grew by about 300%, as I said, between 2018 and 2023. So that's a huge opportunity when you think that only 2% of healthcare VC funding was allocated to women's health. Really? 2%? 51% of the population? 2%?
Wow.
Yeah,
It doesn't work.
It's amazing. And I feel like we have had this conversation a few times over the last couple of years. So it's disturbing, this in-depth, extensive research that you've done to find that we still have a long way to go. Carolee, I hope we can stay in touch, continue this conversation in the future. Carolee Lee, she's founder and chief executive officer of WHAM, the Women's Health Access Matters, joining us from Greenwich, Connecticut.